And just so I'm clear, it's HiDO or HiDO?
Everybody asks the same question. So HiDO, and HiDO stands for Health Information Data Outcomes, and it also means covered in Japanese.
I
HiDO.
love it. Honestly, I was thinking maybe I should have waited until, asking that before I hit record, but
No, 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 no.
that's in
You
there.
could edit away however such you need to do. Okay.
Beautiful. Well, thank you so much, Charles, for joining me this evening. To kick things off, why don't you tell listeners a little bit about yourself and your background and how you came to start your company?
So my name is Charles Gellman, and founding the company was actually not my intent. It was more of a happenstance. So, like a lot of other founders out there, it was not by design. It was because something impacted my life. I was actually misdiagnosed with a kidney stone that led me to a hospitalization with ruptured appendicitis. So I was in the ICU for a number of weeks,
Oh my
and
gosh.
that changed my career trajectory. I was following the path of my brother, who's an investment banker. And after this healthcare space scare, that is when I went to a completely different direction.
Wow. Wow. So just to get a little bit more background about you, I mean, first of all, thank you so much for sharing. I'm sure that must have been a really difficult, time in life, and also what an interesting and unique pivot point. I'm interested to hear about your background itself. You were on this path to investment banking, and obviously you had this healthcare scare that really helped open your eyes to a big gapping hole in the industry. So I'd love to hear a little bit more about that.
Yeah, so my background, I have a master's in clinical informatics from UC Davis School of Medicine, and it's really in data science.
Mm.
So statistics, understanding, and connecting the dots and putting the different pieces of the puzzle together so they make sense. Healthcare, generally is a lot of abstract ideas and people in different disparate places trying to piece it together. And that is the system that we currently live in, which is a 4 trillion plus market, about 20% of the GDP. And that gathered my interest from a data science perspective. And I've really jumped into the technology to try to understand, could we potentially create a blueprint for health? And
Okay.
that's what I'm most interested in doing.
Exactly. So, what problem did you initially identify within that healthcare blueprint? And how did you aim to solve that problem or problems?
Yeah, so based upon my research, I was trying to figure out the best possible outcomes, and that's predicated upon three pillars of health. One is nutrition and diet. Two is exercise and mobility. And the third one, if you struggle with the first two, it really comes down to medications.
Mm.
And when you start to unpack the medication component, is there a data set from a researcher perspective that we can get to understand whether or not people are taking the medications? And that was the foundation that really got me down this rabbit hole that I endured.
So, but for listeners that aren't familiar with your product, tell me a little bit more about HiDO, and how it is addressing that challenge in the medical space or in the medicinal space.
Yeah, so HiDO is an AI assisted robotic device that lives at your home. It automates the process of medication delivery and dispensing. So you walk up to the unit, it uses Face ID to unlock, it dispenses your medications according to dosage, frequency, and pill count. And then we do a medication recording to ensure that you're taking your medications as prescribed by your nurse or your physician.
Wow, I love that. And I do think, what comes to mind from my background, in consulting and being in like that risk element. So the risks of your product right now, tell me about, what those might be. Are there potential for, misuse? Are people taking the right amount? Are they overtaking their medicine or overdosing? Hopefully not, but.
Yeah, so right now what's happening is really a black hole at the home. So if you start thinking about the millions of patients with chronic disease, nobody really knows what's happening. You
Mm.
know what's happening in the hospital or the clinic within a sterile environment where you have a nurse, you have a doctor, you have a pharmacist, you have all these resources. But the second you leave there, 99.9% of your time is spent at home. And most of those folks, they either rely on their family or their loved ones or caregivers. And what you get is variability amongst all of these different households. And that creates a huge, huge challenge.
Certainly. And then, if you have a tool like your own that can effectively, I don't want to say necessarily replace a healthcare provider, but in a lot of ways it can enhance their capabilities just by having that, 24/7 access.
Well, also, it's like, we have a significant shortage of labor and
Mm,
access to providers. So if you even think about it, even if we even had those many people to even monitor, it's cost prohibitive. So for a fraction of the cost, we can have at-home monitoring that elicits good behaviors to keep people out of the hospital or out of the ER because they're finally able to care for themselves without additional folks caring for them.
mm. So tell me a little bit more because I'm curious about what stage exactly that you're in. So have you seen success rates or do you have any success stories with any existing patients?
Yeah, so we've gone live with the Medicare Advantage plan out of Northern California. It's a heart failure population. And what we thought was possible, we blew it out of the park. So when I start, naming the stats, your audience might be like, oh my gosh, that's, monumental. But we had an 80% decrease in hospitalizations and a 67% decrease in the cost of care for these patients. So just
Wow.
think about that. So that spells of two different things. One, maybe patients are struggling more than we initially anticipated, or two, the problem is that big that people are overdosing, underdosing, mismatching medications, not taking them. We really just didn't have any idea prior to the intervention of the AI assisted robotic at the house.
Wow. Yeah. And again, you're saving patients costs, I guess, from that perspective of say, maybe you don't need in-home health aid. But then the longer term ramifications of, being on top of your medication, are much broader than maybe we initially thought. So that's really, really interesting because I hadn't thought about hospitalization prevention as a result of using your product.
Yeah, a lot of people struggle in a number of ways. After you come out of the hospital or the clinic, you may have had a stroke, or maybe somebody has, another different chronic disease, and now they're dependent solely on their loved one, and that's challenging for a lot of folks. So if you can smooth out that process, the
Mm,
recovery time can speed up, and they also get that feeling of independence and freedom because they can care for themselves without having to be dependent on others. And there's 40 million caregivers in the United States right now. Just think of how much of an impact it'll have on their burden and their relief by having a technology that can simply do the basics to help support their health.
I love that. Yeah, certainly. And yeah, our healthcare system is overburdened as it is. So if this can, again, alleviate some of that, it's certainly valuable to not only users themselves, but the healthcare providers. So I guess in terms of patents, IP, do you need FDA approval? Tell me about, the actual rollout of a product like yours.
Yeah, so it is exceptionally complicated
Yes.
architecture and design. So we do have IP patents that have been approved for the system design and architecture, and we have unique transmission within our pill caps. There's an RFID sensor on each one that knows medication dosage and frequency and pill count. So when a user puts the cap inside the device, it auto recognizes all that information for them. So there is unique patents to this. In addition to that, the startup that we founded about 5 years ago, we've raised some funding, some seed funding, and have a number of different NIH grants. But we're looking to raise a Series A potentially in the next 6 months.
Wow, that's very exciting. Yeah, certainly, makes it more capable for you to roll out your product to a wider audience. So that's definitely exciting. And I guess that maybe answers my next question, but do you have any other growth plans for the future? What do you see ahead for HiDO?
Yeah, so we've been doing some research with Rush University Medical Center. It's NIH funded dementia research. And this was something that we never thought would be possible. But so far, the research has gone so well, could have a lasting impact on people that have memory issues and cognitive impairment in the aging population that continues to expand. So to let the cat out of the bag a little early is patients with dementia are able to use this device unassisted without a caregiver. They've had caregivers together at the study and they've just watched them. They set it up, they dispense it, and every single time they're doing it without any assistance. So think of the implications from not just the United States, but worldwide if
Yeah,
people are able to do this on their own.
that is so incredibly exciting. Do you know, I guess, what the patient population count would be for patients with dementia in the United States? Can you say that one more time?
I believe, and somebody's going to have to
We'll
fact check
fact
me on
check you.
this one. Yes, I think it's about 4 to 5 million patients, but
Wow.
someone's going to have to double check on that number.
That's fantastic and so exciting. So I'm rooting for you all the way. I'm super excited to, see where things go with HiDO. Who knows? I mean, I hope that I don't need to have one in my home ever, but maybe someday I'll be using your product. But I'm curious to hear, I know we talked about growth for the future. What, sort of challenges have you faced in getting to the stage that you're in today? And how have you kind of addressed those?
Yeah, I think the number one item that I focus on is really building that solid team around me, folks
Mm,
that are smarter around me that can get us to the point, to the milestones that are needed in order to accomplish what we have put within our mission, our vision with our investors. So it's really about, setting the team up for success and be able to fall forward, fall into those milestones to make sure that we're able to be successful for our patients, most importantly, first and foremost, but secondarily, ensure that there's a marketplace that will receive this type of technology and embrace what we're trying to accomplish.
awesome, Charles. Well, I love that. Thank you so much for sharing. One last fun question before we go. What is your favorite health activity to participate in? Is it exercise? Do you have a favorite exercise? Is it mental? Tell me a little bit about it.
So because of time and because I like to, think and speak, I usually actually go for walks every single night where
Oh,
I'm just
love that.
walking around and then I get a lot of the ideas through my head, during the day and I can sort them out by the time I finish my walk. So I go on walks on a frequent basis.
Oh, that's great. Yeah, that's definitely a great way to slow down a little bit. I myself love yoga. That's my way of coping and just getting my mind to settle down a little bit, but that's awesome to hear. But again, thank you so much, Charles, for joining me. I really appreciate your time here, and I can't wait to share our conversation with listeners.
Thank you so much, Victoria, for having me. Appreciate it.